this so we can post it later. Thanks for joining us. Please give us just a few more moments while we try to get other folks in to watch our presentation tonight. We're grateful for you joining us. And know that we're also going to be streaming this live on our Facebook page tonight. So I have to get that ready. It's one of those fun little tasks that takes a few, some button pushing. All right. So, hi everyone. Thanks for joining us on Zoom. I'm going to set us live on Facebook now. Okay. Hi everyone. My name is John Nelson. I am the AVP of Community Government and Public Relations for Nuvance Health, and pleased that you join us tonight for our virtual community forum, the first of this year. And I'm happy to introduce Peter Cordeau, the president of Norwalk Hospital, and he will take it from here. It's very nice. Thank you so much.
Thank you, John, and welcome everybody. It's my pleasure to present to you a community update. We are on year 3, so for those of you who have attended in the past, this presentation should be relatively familiar, and I'm really excited to discuss the progress. So the hospital updates in the beginning, we're just going to talk about very briefly related to what we're doing still, related to the COVID pandemic, new developments, the Cancer Institute. I did accidentally skip awards and recognition because we've done just such an amazing job this year, and I'm very proud of Norwalk Hospital. We'll talk about the Cancer Institute. I will introduce Ildi Rabinowitz, our AVP of Health Equity, Diversity, and Inclusion. She's new, and I look forward to doing that. And then we will move over to our independent monitor and Dwight Tarwater from PYA, and then we'll move into Q&A. So John, we can move forward. So safe care, obviously the transition into safe care has really been ongoing. Not much has changed. I'd say the biggest thing that's changed is the evolution of the visitation policy. And as of 7/26, so 13 days from today, our visitation will be 12 hours a day, 8 a.m. to 8 p.m., which is an increase from our current 11 a.m. to 8 p.m. and really light years away from back when there was no visitation. So we're really moving forward, and we're really getting used to adapting into this environment of the pandemic, and not only through COVID, but post-COVID, or what the future is going to look like. Next slide, John. Thanks. Also remember, there are plenty of vaccines out there. If you haven't had your booster, get your booster. Anyone over 6 certainly can get their vaccine. I know there's plenty of vaccine available, and really we are seeing, hopefully that's not to me. Okay, sorry, John. There's a lot of vaccine available, and we're seeing a lot of people get COVID. So it is very important, and it is a good public service announcement to everybody as we start this meeting. John, can you move forward? COVID recovery program. We were one of the first, if not first, in the state of Connecticut to really start to address the long-term issues of COVID-19. And this is just a reminder that should you be suffering, or someone that you know with long-term COVID issues, to call our number and schedule a virtual appointment, and then any follow-up care can be arranged for you through this great service that we've been providing for the past few years. All right, I'm proud to present the awards and recognition for Norwalk Hospital over the past few years, but really these 2 awards actually came about a week apart, and less than a few weeks ago. The 2022 Mission Lifeline is for STEMI receiving, and for those who don't know what that means, it's ST Elevation MI, which is basically having the big the big heart attack that requires emergent intervention through our ED to the cath lab to open that vessel to save your life. And we received the Mission Lifeline Gold that we're extremely proud of at Norwalk Hospital. And to tag along with that, not surprisingly, we received the Gold Plus Award for Stroke. This is also a service where we are a primary stroke center. We are also a thrombectomy ready center, one of only a few in the state. And this is a really a testament to the great work that's done by the cardiology and the neurology team. And this team really does a lot of this work together and covers both of it. So it's not a surprise that we received both of those awards at the same time for the same dedicated staff providing these outstanding services in our community. Next slide. Norwalk Radiation Oncology also earned the American College of Radiology accreditation, which is not an easy feat. It's a very rigorous accreditation process. I'm very proud that we have received our accreditation and continue to provide outstanding services under the leadership of Dr. Gilbo, who's up there in the top left. And really most important that I'm terribly proud of, for the past couple of years, we've been a top 250 hospital for health grades. And this year, Norwalk Hospital has been named a top 100 hospital by Health Grades for demonstrating superior clinical outcomes. And it is primarily driven by, going back a few slides, that stroke award, and the amazing work we've been able to do in stroke has really catapulted Norwalk up into that top 100, putting us in the top 2% of all acute care hospitals in the nation. So I'm very proud to be leading this great hospital. And this is really some great praise for the work being done. Also, kind of like the little engine that could, Norwalk Hospital continues to do things that you'd only see in really larger academic medical centers. And our own Dr. Jim McLean has helped us receive and really did the primary legwork for a national accreditation program for rectal cancer. It is the first in the state of Connecticut. And as I look, it's an initial 3-year accreditation for the program. It only grants accreditation to programs that are committed to providing the best care to patients with rectal cancer. And we're also an American College of Surgeons Commission on Cancer accredited institution. So congratulations to Dr. McLean, Norwalk Hospital, and the great care, again, we are providing for our cancer patients at Norwalk Hospital. Next slide, John. Thanks. This is some really exciting news that just came out a week ago. Norwalk Hospital Heart and Vascular Institute is now an affiliate of Cleveland Clinic. It's Heart and Vascular and Thoracic Institute. And this is really, really important, as Cleveland Clinic is the #1 cardiac institution in the country. They have sites around the United States and around the world, in England, in Dubai, and to be a partner with them, to share in our clinical models, to really give access to our patients to second opinions, to be part of clinical trials, the latest technologies and innovations in heart care, is what makes this relationship really special. And the Cleveland Clinic just doesn't partner with anybody. And I think that's very important. To have the prestigious relationship with the Cleveland Clinic is really a testament to all the great work that's being done in our Cardiac and Heart and Vascular Institute with Dr. Mark Wachowski and Kelly Stock, and they put a lot of work and time into this relationship. So very proud of this recognition, very proud of this work, and look forward to really developing and enhancing the cardiac care that we provide, not only in Norwalk, but other higher level care that we're going to be providing throughout the network. Next slide, John. Really our ultimate goal, when we became Nuvance, was to be able to provide the majority of care close to home. So we've really grown our ambulatory footprint in Norwalk created 3 multi-specialty sites. We have our Norwalk Radiology and Mammography Center at iPark, and just this past Monday, all of our radiology equipment's moved to iPark. You will have a beautiful 108,000 square foot multi-specialty site that'll have all of your imaging equipment, your oncologists, your breast surgeons, primary care, OBGYN, and all the specialists associated with that. So you can receive all your care in one spot, not only to have care close to home, but for your convenience. If in fact you need a procedure, literally 3 miles away is your Norwalk Surgery Center. That's a multi-specialty surgery center that provides the entire suite of ambulatory surgery services and continues to grow. In that building in 40 Cross, again, we've made a 15-year commitment to really build that space out for a second multi-specialty space. And as our third multi-specialty space, again, to provide care closer to home and to enhance and provide convenience, is the Wilton Wellness Center multi-specialty suite that not only has primary care, endocrine, but with a relationship with ONS, the orthopedic and neurosurgery specialists on the second floor, really allows patients to, again, have an assessment with their primary care doc, get referred for their specialty care. And should they need acute care surgery, can go to Norwalk Hospital, or if they need something in an ambulatory setting, again, can go right down the 40 Cross and schedule their care close to home with their surgeons and their follow-up care right around the corner. So I'm happy to introduce some new employees to Nuvance Health, and congratulations to some employees that have been promoted and have expanded roles. So Ildi Rabinowitz, our AVP of Health Equity and Inclusion, I introduced her role briefly in the beginning, and she will be presenting to you at the end of my presentation. Michelle Robertson is our new incoming Chief Operating Officer, who comes with a wealth of experience from the Ascension system, and most recently was down in the Nashville, Tennessee area. I've had the privilege of working with both of the physicians that have accepted expanded roles within the organization, Dr. Elizabeth Lukel as the System Vice Chair of Women's Health Services, and Dr. Brenda Ayers, the inaugural Medical Director for Health Equity at Nuvance Health. So congratulations to them, and welcome to Ildi and Michelle. And again, this is just another example of how we continue to grow as part of Nuvance and providing high level of care and bringing in exceptional talent as we continue to grow as a network. We're not only growing, and I think this is such a special story. I've had the privilege to work with George and Carol Bauer since I've been at Norwalk Hospital since January of 2019. The Bauers generously donated $20 million towards the construction of what will be called the Bauer Family Pavilion, part of our new 188,000 square foot addition to Norwalk Hospital. But what's more impressive than the dollars is that George has been a board member forever and contributes to the hospital. They not only contribute with their dollars, they contribute with their time and their love of the hospital. Carol Bauer has, per her words, spent over half of her life at Norwalk Hospital. She's a hospital chaplain, has been volunteering for 40 years. I just spent an hour with her yesterday as she was working the second shift, volunteering her time as a hospital chaplain. Their dedication to Norwalk and the Norwalk community is second to none. I can't thank them enough. And just yesterday, we received another $10 million commitment from the McGraw family, who have also been generous contributors and philanthropists to Norwalk Hospital for our ability to grow and expand and continue to be in Norwalk for the next 100+ years. So I can't thank both families enough. George and Carol Bauer hold a special place in our hearts at Norwalk Hospital, and thank you, George and Carol. Also, we've been busy politically. We've had visits from multiple visits, 2 visits from Senator Chris Murphy, two visits from Richard Blumenthal. One to thank our staff. In the most recent visits by both senators was related to a $2.15 million earmark, which I believe now the political term is congressionally designated funds towards Norwalk Hospital, really towards our plan to expand our outpatient behavioral health. Again, another growth proposal by us in Norwalk and Nuvance Health to provide intensive outpatient adolescent psychiatry and adult inpatient intensive outpatient psychiatry services expanded to the community. In conjunction with that growth, we have secured a 35,000 square foot area that Senator Chris Murphy and I held a community event similar to this to field questions and really talk about the behavioral health needs of the community, as well as discuss our behavioral health residency program, where this year, as of this July, third year, psychiatry residents will be providing free clinic ability for our area in a specialty that's primarily cash-based. These services are not really available in our community, and our ability to expand our behavioral health footprint in the ambulatory space will, our goal is to prevent crisis. Our goal is to address behavioral health upstream versus by the time someone ends up in our ED. So we are really thankful for the earmark. Senator Richard Blumenthal stated that hopefully this is just a down payment on the work that we're doing in our community, and we couldn't thank them more for their support. Senator Chris Murphy is also very passionate about behavioral health and was discussing with us the bipartisan bill he was working on with another senator whose name escapes me. But again, we have friends in our corner, and they have been great supporters to Nuvance Health and Norwalk Hospital. So thank you, both senators and Representative Jim Himes. I don't want to leave him out because he's been instrumental in this also. So our cancer center, we are, next slide, John. So this might not mean a lot in the ketogenic diet study. It sounds more like something we're using for weight loss, but the diet study is for advanced pancreatic cancer. And we are blessed to have Dr. Richard Frank, one of the nation's experts in pancreatic cancer. He has been based out of Norwalk. He does much of his research out of the Norwalk area. And so we are the only site in Connecticut doing this study. And it's a 36-month study. There have only been a few selected sites in the United States. And again, because of Dr. Frank's prowess in this area, Norwalk is one of those sites. And we're also working on other experimental is the wrong word, but other therapies and therapeutic trials with Dr. Frank. And it's very, very rewarding to be able to do this type of work in a community hospital that you would otherwise have to go outside of the community, most likely to New York City for this type of work. So thank you, Dr. Frank, and real testament to the oncology work that's being done at Norwalk Hospital. I had the privilege back on May 14th to be the MC for the Whittingham Cancer Center Walk and Run, which was by far the most heart-touching cancer walk and run that I've attended in my time at Norwalk Hospital. Folks were just so happy to be together. We were able to celebrate 25 years of caring for the Whittingham Cancer Center. It was just outstanding. Raised about $150,000 for the event. And another event that we didn't put in here is I had the opportunity to receive a check from area second graders who collected change to donate to the Whittingham Cancer Walk and Run. So it was a wonderful day to have an auditorium full of second graders screaming and yelling, getting their Batman cupcakes, and donating that massive check. The giant cardboard check for the Whittingham Cancer Center. And this is something that they've done every year. So again, a great example of community involvement and the passion that they have for Norwalk Hospital. So it was a really wonderful event. I thank the Whittingham family and everyone that made that possible. Now I would like to introduce to you Ildi Rabinowitz, our AVP of Health Equity, Diversity, and Inclusion. And Ildi has a wonderful presentation to share with you. Ildi?
Thank you, Peter. Thank you so much for inviting me here and allowing me to talk today. So I just wanted to share with you, yes, Peter mentioned I'm very new to the organization. And as I'm learning the community and our organization more and more, it's really, really clear that we really need to talk about what diversity means to the communities that we are serving. Also, what diversity means to our organization. And in addition to diversity, we are talking a lot about what inclusion means. Next slide. Because we are embarking on that amazing journey of embedding health equity, diversity, and inclusion into the culture of the organization, it's really nice to see that we have the support. So I can tell you how thankful I am when I'm reaching out to a community-based organization or any of our leaders or teams within the organization. I am seeing a true readiness for this work. So I'm very excited about our journey because I know that we are going to be really creating an environment for our communities and our internal workforce where people will feel welcome, respected, valued, and where people can feel a true sense of belonging. So you see on this first slide, diversity, inclusion, and equity. And I just want to talk a little bit about how these different elements really intertwine and how these different elements, when we embed them in the organizational culture, we really create that environment where we are providing remarkable care. But also we are becoming an organization where people will want to stay with, will want to work. And it's really amazing that I know that we are going to get to a place where we are already at a good place, but we'll be also growing in a lot of spaces together. So let's talk about what diversity is. Diversity, we know that we have a lot of diversity in our communities, diversity really is the similarities and differences that we see in our communities and our workforce. But a true sense of diversity is really the importance is that we see, we look at these differences and similarities as strengths, not as weaknesses. And when we do that, we are going to really arrive to the point where we are including others. When we are including our community members, we are including our community-based organizations in planning the care, also including our patients and their families in planning their care within the organization, but also including our workforce at looking at processes, coming up with ideas. So all through the organization and externally, diversity inclusion does have a huge impact. And the way we are going to be creating equity and health equity for our communities is truly including and hearing the voices of others. So creating the Office of Diversity, Inclusion, and Equity was the first major step for the organization to really bring this work together, to really focus on areas that we can embed a lot of work to make sure that we are creating health equity for all of our populations. And we do have a few members of our team. For example, Peter, you mentioned Dr. Ayers, Brenda Ayers. She's the new medical director for health equity. And she really looks at clinical outcomes to make sure that our clinical outcomes are looked in a way where we truly understand where our gaps are, where our opportunities are, and really partner with institute leaders and different departments to close those gaps, to really impact the care quality in a way where we help each population achieve health equity. Next slide. So I wanted to show you this, what our main goals. So embedding this health equity, diversity, and inclusion into the culture is really not something that is extra work. We are already doing this work, but we are going to be embarking on this journey when we're really intentionally looking at processes, policies, and ways we do things, because diversity, inclusion, equity really is going to be impacting our business strategy. And they are all shared drivers. So for us to be a successful and sustainable organization where we will want people to stay and our patients to stay with us, we will really need to make sure that we are looking at our processes and everything we do to make sure everybody feels welcome. So for example, our main goal, one of our main goals is to become the provider of choice in the region. And we want to make sure that when our patients are coming for care, they know when they come to Nuvance Health, they will receive a remarkable, innovative, and excellent patient care, regardless of the dimensions of diversity. So we want our communities to trust us, to make sure that they know that we are going to give the consistent and excellent care to them. We also want to become the employer of choice. So we are really looking at different processes, including our workforce, including our policies, and also our benefits packages, to make sure that we are accommodating the needs of our communities, and we really become the place where people we want to work and we want to stay. And of course, because we are a healthcare organization, we really want to make sure that we are providing equitable care. And I will talk to you a little bit more about this work, but health equity is really something that we are striving for. We want to make sure that each of our populations have the best chance to live the highest quality of life, which is the definition of health equity. Next slide. So how are we going to become the provider of choice? The only way to do that is really considering the cultural nuances and the cultural aspects of our community members. So when we are providing the care to our community members, we really need to stop and pause and really start thinking, how is this patient is different from another patient I've seen an hour ago? I really want to make sure that I'm caring for that patient the way that patient wants to be cared for. And the only way we can do that if we truly understand the cultural background of the patient by asking the right questions, educating us, and also making sure that we are really listening to the experiences of our colleagues, our leaders. So we just really need to make sure that we are considering what culture is and how culture impacts healthcare outcomes. On the left side on the diagram, you're going to see the iceberg. And really this displays what we might be seeing when we see the patients right away. And what are those things that are below the surface that we need to ask the questions about? So sometimes when the patients come in for care, they're not going to be telling us a lot of things, and we will only see what is above the surface. So we really need to be intentional by understanding the needs, understanding the culture. We need to know what questions to ask to make sure that we are not creating barriers for the patients who come to us for care. Next slide. And as I mentioned earlier, we want to become the employer of choice for all communities. So we are currently looking at many processes. As I mentioned, we are looking at our workforce demographics. We are looking at our Hispanic and Asian populations being represented, and also our brown and Black populations represented in our workforce. So we want to make sure that the people who are caring for our patients, they are mirroring the population that we are serving. So it is really important that we are really closely partnering with our Human Resources Department, and there's an amazing partnership to make sure that this happens. We want to make sure that our recruitment practices are mirroring best practice. We have our Human Resources Department is embedding a lot of work into the community resources and also creating pipelines, permanent long-term pipelines, to make sure that we are going to be able to onboard community members from diverse backgrounds, and not only onboarding them, but also we want to keep our newly onboarded team members. So we are doing a lot of work in that aspect. On the right side, you're going to be seeing equitable growth opportunities. We are looking at different processes and also talking to different leaders to make sure that we are providing equal chances to everyone for growth, for training, for people to feel that they can really grow within the organization and they have the same chances as others. I want to mention a little bit about the employee resource groups. For our employees, team members to feel at home and feel connected to others, we need to create the spaces, the safe spaces, to make sure that they can make friends, they can make connections, also become visible within the organization. So recently, we created many employee resource groups that are based on different interests, different passions. One of them, for example, is the Hispanic and Latinx ERG. We have a Black African-American employee resource group, among others. A few to mention, for example, we have a Thrive and Allies employee resource group that is really going to help with running discussions around mental health and also about substance use disorder, but also just to discuss areas that might make people feel better in general. So we just want to make sure that we are creating these safe spaces for conversations, activities, engagements, and also just to have fun and stay engaged with each other. Next slide. So you see the employee resource groups are here. So a few months ago, we had a couple of employee resource groups. We had Black African-American ERG. We had an LGBTQ employee resource group, and we had one more ERG to start with, a Hispanic Latinx ERG. But through the time, we expanded these employee resource groups. And we didn't only expand them, but we wanted to make sure that those who don't identify with that employee resource group, the allies who are passionate about that subject, they can also join. So that's the reason why you are seeing really the LGBTQIA and allies, similarly to the disabilities and allies employee resource group, because we want to make sure that employees who don't necessarily identify, but they are passionate about the subject, they can also join the conversation. Next slide. So I mentioned earlier about health equity, and I talked a little bit about our journey to really become a leader of health equity in the region. There are different ways to do that, and we are going to be investing a lot of efforts to make sure that we are providing equitable care to all of our populations. But there are different ways to get there, but we really need to create a framework and look at elements that we really need to meet those requirements to be able to become the best, one of the best in the region. So you see on the left side, one of the versions of designations that we really want to achieve. And this is the NCQA designation for health equity. And there are different steps in this designation. There is NCQA designation for health equity, but also the next step is the designation for health equity plus. But first, we are going to be striving to receive the designation for health equity, the NCQA designation. And why we are doing that, we are currently working on many elements, such as cultural competency, looking at our demographic data collection processes to make sure that we are collecting data, demographic data from our patients to be able to serve them the best. But also we are looking at our language services, interpretation, and we are really embarking on a lot of work in identifying disparities and also addressing inequities in our patient populations. Next slide. So one of the most important things, and I can't emphasize enough how important it is to connect with our communities. So we already have, I'm pretty sure you heard some of the work that is already being very active in the community is the community care teams and community health committees. And in the future, we are really going to be emphasizing on strengthening these relationships, the work that is already going on in these spaces. But we are going to be intentional of creating new opportunities, new relationships, even reaching out to our community faith-based organizations and creating long-term relationships, investing in this work, because the only way we can meet the needs of our community if we are really in touch, in connection, and we are having those conversations to make sure that we are able to make an impact. Some of the work that we've already been engaged in is, about, I'm pretty sure you heard about the community health needs assessment work. Many organizations, health departments, many groups are included in completing the community health needs assessment. where we really find out what are those gaps, what are those areas where we need to make an impact within the next 3 years. So just to give you a little highlight, we just finished the community surveying process, and we will be looking at where we are and what plan we need to make sure that we are going to be closing those gaps, disparities that we are finding within the community. We also are going to be completing a lot of community-based education. So we are going to be connecting to these organizations and new relationships we are going to be leveraging to make sure that we are in the space to provide education in the language that we need to provide this education in. For example, we are going to be connecting with international community leaders, churches, and we will be using interpreters and bringing community education in the patients' in the community members' languages to make sure that we are creating health equity and equity in our communities. Next. And I think this is the end of my presentation. And now I'm going to turn it over to Dwight for the rest of the presentation.
Thank you so much. Can you hear me okay? Okay, great. All right, John, if we could go to the next slide. So thanks everyone for having me. My name is Dwight Tarwater. I'm representing PYA, and our firm is serving as the independent monitor, monitoring Nuvance's compliance set forth in the agreed settlement required by the Connecticut Office of Health Strategy, which I'll reference throughout this presentation as OHS for the merger of HealthQuest and Western Connecticut Health Network a few years ago. Many of you may have seen me before. This is not the first time that we've done this, but ever since the merger, it's been our duty to meet with the community on a semi-annual basis to kind of report our findings to the community. So what we're here to talk about today, and I'd like to also note that we're only engaged to meet with the Connecticut hospitals, and this will be our first meeting for this round. We'll meet with Danbury and Sharon later in August. But what we're going to talk about today is we'll quickly go through our role, kind of our timeline for the past 6 to 8 months. Then we'll talk about our findings as well as next steps to look out for, and then wrap it up with any questions. So our role, while we report to OHS, we are actually retained at the expense of Nuvance. And again, as I said earlier, we're responsible for monitoring Nuvance's compliance with a long set of conditions, about 23 conditions set forth in the agreed settlement. And lastly, we're retained by OHS for 5 years. So our duties, and our main duty is we have on-site visits twice a year with each hospital in Connecticut. So that's Norwalk, Danbury, and Sharon. As you'll notice throughout this presentation, ever since March of 2020, we've been conducting these semi-annual visits virtually to be as safe as possible. 30 days after that visit is when we're required to submit a written report to OHS. If you actually jump down to 4 there, 60 days following that report is when we're required to meet with the community, which is what we're here to do today. If you go back up to 3, another requirement of us is that we're to meet with community representatives on a yearly basis. And then lastly there, number 5, if Nuvance is out of compliance with the conditions, we'll notify OHS and Nuvance, and we'll work together to determine compliance and put a corrective action in place. So here's our timeline for about the past year or so. As you can see on the left side is we met with PFACs, and that's Patient Family Advisory Councils, which is a informed group of individuals within each hospital's community. And we met throughout fall with those groups. Within 30 days, we developed and submitted our 5th period report, and we're able to present findings in December at last round of community forums. We met with Nuvance leadership in June of this year, submitted our report last week, and are starting these forums today. Next slide, John. So here's our summary table of findings, and I think it's It's important to note here that not all conditions are going to be required, or they're not going to apply to every period. So these listing of conditions are only applicable to this 6-month reporting period, which ended at the end of March of 2022. So number 1 and 2 kind of run hand in hand. It's community representation on Danbury, Norwalk, and Sharon boards. We've reviewed both rosters, and we have seen that Nuvance is compliant with those 2 conditions. As I mentioned earlier, joint board meetings are to be in place twice a year. Nuvance held a joint board meeting in the fall of last year, and then I believe this summer. So we were good there. Number 4 is culturally and linguistically appropriate services. So we did a review of all of these policies related to CLAS, and we concluded in period 1 that Nuvance was compliant, and we've confirmed that those policies have not changed since the first period. Number 5 is maintain current charity care policies. These policies have not changed since the last reporting period, so there's really no action there. Nuvance is compliant with that, with condition 5 there. 11 is independent monitor on-site visits. As I mentioned, this is virtual, and we met with Nuvance leadership in June. 12A is the community members. That would be the PFACs, which we met with in fall of last year. 12B is what we're here to do today. That's why there's a green box there. Public forums. Number 15 is cost savings for hospitals and report of financial measurements. So Nuvance was able to submit a filing in November, which was a report of cost savings for it was the complete cost savings for fiscal year 21. And while the condition says that they're to meet cost savings goals, it says if they do not meet these goals, they just need to explain why. They didn't meet the goals for 21, but they had a great response to why. And as we know, it's been difficult with the public health emergency. So we have concluded that Nuvance was compliant with that condition. Number 18 is to maintain a sufficient OB/GYN physician staffing. We have concluded that there is sufficient OB/GYN staffing. It's important to note that in September of 21, Nuvance announced a plan to suspend labor delivery services at Sharon. We don't know much about the timeline at this point. We concluded in our report that the timeline was unknown for suspension, but we did review the staffing rosters and can conclude that there are sufficient staffing levels over at Sharon. 20 and 21 kind of run hand in hand. They're just annual reports, updating quality performance, then other integration initiatives such as EMR consolidation, maintaining a robust compliance program, and a few others. And Nuvance was able to meet those standards as well. So next steps, continuing to monitor Nuvance and regularly check in with Nuvance and OHS. We'll look out for the 7th semi-annual report and our next round of on-site visits. That'll likely occur at the end of this year. And then our next public forum, whenever the milestones line up, we'll look forward to seeing you soon next time. I'll stop for any questions. If not, I'd like to note that Nuvance has been a joy to work with, and appreciate everyone having me.
Thanks, Dwight. Appreciate it. And it's at this time our presentation is over. We do have some attendees both on our Facebook page as well as in Zoom. So we certainly have panelists here who are ready and willing and able to answer any questions. If anyone has any, please feel free to let us know. We'll stay on for just a few minutes and see if we have any questions. We don't have any on Facebook right now, but if you would like to ask any questions, you are welcome to type them into the chat or in the Q&A and Zoom feature. And, if not, we will call it a night, which we're, also, willing to do. But I don't know, Peter, if you had any parting words while we wait to see if there are any other questions.
Sure, I'll add a couple. One, thank you to everybody. To really look back over the past 3 years and 3 months, it has really been an amazing progression and growth of Nuvance Health. It's very difficult to describe just not only how difficult it is to become a new system, but to do it in the middle of a pandemic. The system, the network, our sister hospitals have grown tremendously. It's just been, it's really nice to be sitting on this end of the 3 years to see just how far we've come and how much we continue to do and how much we live up to our mission to serve our communities. So I just wanted to let really our Norwalk community know that we continue to represent the community well, whether we're just Norwalk Hospital singularly or Nuvance Health is a network, and we will continue to be there for the next 100 years for everybody.
Fantastic. Thanks, Peter. We do not have any questions, so we are going to bid everyone a good night. Thank you so much for joining us, and we will see you in the community, and we will see you at our next community forum. Thank you so much. Have a nice night.
Good night, everyone.